In total, suicides have increased between 1999 and 2016 by about 25% nationally. South Dakota has seen that during that same time period, a 44.5% increase as well. 2016 is the latest data available for all states, and we rank 13th highest for our suicide rate. In 2017, we had the highest number of suicides ever recorded in the state, with 193 suicide deaths. South Dakota specifically, we have actually a 30-year difference between what happens nationally and what happens in the state. So our highest rate of suicide deaths occurs in individuals aged 20 to 24, whereas in the national data, the rate is highest among 50 to 54-year-olds. So that's a 30-year age shift. Overall in South Dakota, about 80% of our suicide deaths occur among males and only 20% among females. But among those who have attempted suicide, the proportion that have attempted suicide is much higher among females. So what that tells us is that females are attempting suicide, but are not doing so by lethal means. They may be taking pills that then are able to be reversed at the hospital, whereas individuals, males specifically in the state, may be using lethal means such as firearms that lead to them taking their lives. So specifically, there is data out there that's captured by a system. It's called the National Violent Death Reporting System, and I'm glad to say that that system is coming to South Dakota. We were just funded by CDC to help identify what some of those risk factors are for South Dakotans. Nationally, we know that the top factors include problems related to relationships, those that are in poor physical health, as well as individuals who are having problems with substance abuse and other individuals who may have had a recent crisis or an upcoming crisis. One of the things that we do know about that is that older Americans are at greater risk for depression, especially after loss of someone that they've spent their life with. So that creates a huge amount of stress in their life and can predispose them to suicide risk. So in South Dakota, we do have rates that are 2.3 times higher among our American Indian population than we do our white-raced individuals. And some of our higher rates among counties have been among some of the more rural locations, number one, but also counties that are primarily American Indian. I think a lot of it comes down to social connectedness, stigmatization for individuals in a specific area. There are the social support network is not as well developed in some of those areas. And I think the other thing to remember is that suicides are multifactorial. It's not just one thing that leads a person to commit suicide. There are a lot of other factors. Well, I think it's mainly just that the going to a healthcare facility or trying to go to a healthcare facility for a mental health condition is just harder in rural locations because they're either not available or not as readily available. And so when you're traveling long distances on a regular basis, it can be difficult, number one, but it may also identify a person as seeking out mental health care. I think there is an opportunity to expand mental health services in communities to try and decrease the stigma around individuals who are seeking care for mental health conditions, as well as just having more opportunities to get people into care. It is interesting to note that 54% of individuals who committed suicide nationally did not have a known mental health condition. So we do have Suicide Prevention Awareness Month, which is September every year. So we're doing a lot around raising awareness in communities, trying to decrease the risk of stigma with reaching out and getting mental health care, as well as there's the Be the One SD campaign, which is targeted at our youth in terms of helping them know how to approach an individual who may be at risk of suicide, who may be having problems. And we also have the sdsuicideprevention.org website that has a lot of good information. It has county level information on suicide attempts and suicides. It also has information for prevention toolkits for specific populations, including teachers, American Indian population, the elderly, and so on. What I can say is that about 50% of our suicide deaths are due to firearms in the state. And I think we do need to be cognizant about that as we try to discuss what efforts might be best at prevention.